Cardiovascular disease is the #1 cause of death in the United States. About 800,000 people die each year. Someone dies from a heart attack every 36 seconds, and so that's about 2 people every minute, which averages close to 2,400 deaths per day. And then someone dies from a stroke about every 3.5 minutes, so 2 people die approximately every 7 minutes. Not as many people die of stroke, but it's still a significant impact in the United States. The cost is about $363 billion a year. That includes healthcare services, medications, any kind of services that provides cardiovascular care, and also for people that have lost time from work, loss of productivity. There are numerous risk factors for heart disease. Ones that you cannot control are your age, whether you're a male or a female, and who your parents are and your heredity. The ones that you can control are smoking, and smoking increases your risk of heart disease about 2 to 4-fold. Physical inactivity. About 25% of Americans exercise appropriately, which means that they exercise 30 minutes 5 times a week. 25% do not exercise at all, so about 50% get either very little exercise or not enough exercise. Obesity, about 40% of Americans are obese, which is a significant amount, either obese or morbidly obese, and 48% of Americans have very poor dietary habits. About 47% of Americans have hypertension, which is another risk factor, and then diabetes is a significant one. There's about 373 million people in America with diabetes, and about 96 million more that have prediabetes. COVID has directly affected coronary artery disease in the United States. Basically, when you have COVID, your body goes into a state where you're not getting enough oxygen, which impacts the heart significantly, causes stress on the heart, and we've seen an increase in people that have come in with COVID with more myocardial infarctions, which is a heart attack. People have also delayed getting care because they've been scared to come to the emergency department because of fear of getting COVID. Also, indirectly, COVID has affected coronary disease because of the things that we've done during COVID, which is quarantine, and our eating habits have been poor. There's been an increased amount of alcohol consumption. There's been less exercise for people not going to gyms or either just not getting out doing exercise because of the quarantine, and also the mental toll of being quarantined and the stress of that. There's been a lot of talk in the last several years about what you can do to prevent coronary disease, and they've narrowed it down to Life Simple 7, which is to be active. You need to do at least 30 minutes of an aerobic exercise 5 times a week. Heart healthy diet, which is more vegetables, fruits, whole grains. Keep your weight at a healthy weight limit, which is a BMI of less than 30. Everyone needs to know what their cholesterol is. We'd like for everybody's cholesterol, their bad cholesterol, to be less than 100. If you have coronary disease, to be less than 70. The other thing with diet is make sure about diabetes that you know what your hemoglobin A1C is, and you want it to be 6.5 or less. And that goes back into making sure your diet is good, and then blood pressure control. And everybody's blood pressure should be less than 140/90. And the biggest one is to stop smoking. There has been a decrease over the last several years of people stopping smoking, and that is a big impact on cardiovascular disease and stroke. So if you smoke, stop. If you're not, don't start.